going to share a few details regarding the knee and why the inner portion of the knee is where most people that I've worked with have pain without having a traumatic injury. So we're not talking about a ligament tear or cartilage tear from a sports hip injury, but just from mild challenges without event. So talking first about the kinetic chain, think from the ground up. The knee is like the middleman. It has no independent leverage. It is very much requiring input or effect from the foot through the ground, and more especially from the hip, as it will really control the orientation of the knee. So when the foot hits the ground, if the hip does not have control, then the knee is going to collapse because it's going towards your center of gravity or center line of gravity. So again, the hip is going to be what dictates what's happening at the knee by orientation or alignment, and then the foot and through the leg is going to also affect control with holding back from collapsing forward. It's very common for people to know that the primary motion of the knee is extending or flexing the knee. What is not as common knowledge outside of medical providers is that at the very end, you'll observe that the foot turns out just a few degrees. I'm going to emphasize the motion at the ankle. And so when your leg is straight, if my femur or thigh is straight up and down, my toe is slightly turned out. As it bends, it turns to be straight ahead. An exaggeration would be turning the foot in. So when standing, when straight ahead, and when you fully straighten, that little pivot to be turning in. So again, there's a difference between here. It doesn't stay turned in, and it also doesn't stay turned out. So the vastus medialis, a portion of the quadriceps, is most active in those last few degrees, and so that sometimes can make it painful if this is agitated to fully finish contracting and fully straighten out the knee. And if you do not have full extension, then it changes your walking pattern and several other things. The other detail that I'd like to point out is that when you're bending the knee with exertion, again, the hamstrings are meant to be the primary source of motion, but if the hamstring or the quadriceps is not doing well, then the calf likes to contribute, and it'll actually act like it's pulling in more from the ankle rather than from above. And when the calf is contracting, then you'll feel a pressure sensation up in front. So if when you're bending the knee, you feel resistance up front, then that lets you know that your calf is overactive. So when doing an exercise to focus on that, if you're going to the gym and use one of those hamstring curl machines, because the pad is often below the calf, it's really hard to get focus there, but give it a lot of concentration, or do a few exercises on your own where put your hands behind the knee and then block it there, just to give that extra focus. So again, just a few things to consider. As for the knee, we literally have a little twist going on every day, and something to pay attention to if you have to return to common function.